So, while some of our medications, the stimulants, have been around for more than 75 years, they existed in one form until relatively recently. There would be an immediate release medication. People have heard of Ritalin or Adderall that would last perhaps 4 hours. Might have to be taken 3 or even 4 times a day for some people, which is almost impossible to do reliably every 4 hours when a child is in school or an adult is busy at work or parenting. And so people were having peaks and valleys in terms of how much medicine's in their body, multiple side effects because of that. And so even though these medicines have been around for a long time and we know they're safe, the new extended releases that have been available in recent decades and some new ones that have come on the market just in the past couple of years can make a big difference. The other point that I think is important is that there's a lot of evidence that combination treatment with more than one medication can work better than one medication alone. We often see people here who've gotten good treatment from their pediatricians, but the reality is that their ADHD hasn't responded adequately. They're still having substantial symptoms, and it's because they're being prescribed one medication, which just isn't doing enough. And often combining 2 safe, effective medications, the most frequent combination is an extended release stimulant and a medication called guanfacine extended release or Intuitive. That combination is almost always, though not always, better than either one alone. It can help provide ADHD treatment in the morning before a stimulant kicks in and in the evening after it wears off, so that we're not only treating the hours during the school day, which are important, but also that time at home when parents are struggling to round up a rambunctious kid and the quality of family life is being meaningfully affected. So there is a new extended release methylphenidate-based medication, Jornay, which can be taken before a child goes to bed, absorbs about 10 hours later, and so kicks in the morning. And it's one of a number of newer medications. Another one is Mydayis, which is a 16-hour extended release stimulant, that for some patients can be more helpful than the medications that were previously available. The way that we think through treatment here is to start with medications that have the longest track record, an established track record, and that we know are going to work in a certain way because any one of us has prescribed them dozens or hundreds of times. But again, a lot of people that come here have already been on those medications with their pediatrician or their primary care provider, and for one reason or another, they haven't been effective. And so one of the privileges in working at a center that specializes in ADHD and related disorders is that we do see folks who haven't benefited from those medications that more physicians are familiar with. And we do have those experiences with the newer medications, either alone or in combination, to help people achieve good treatment response, really improve in terms of their ADHD symptoms, and lead lives that are fuller and more meaningful and easier to manage and less stressful because we have familiarity with these newer medications.